there, I'm Emily Russell with Clearview Regional Medical Center, and today I'm coming to you from our brand new Clearview Wound Healing Center. The Wound Healing Center just opened very recently, a couple of weeks ago, and is located at 705 Breedlove Drive, Suite 300, and they are open for business and seeing patients. And I am fortunate enough to be here today with our new program director of our Wound Healing Center, Miss Stephanie Berry. Thank you for joining me today, Stephanie.
Sure, Emily.
Thanks for showing us around. So our wound center has been open for how long?
It opened on Monday, June 16th. We got to see our first patient then, and slowly we've been ramping up. We have about 10 patients at this time.
Fantastic. Okay, so I hear about patients and I hear about wound healing, but what is the typical type of patient that you might see here at the Wound Healing Center?
Mostly what we're looking for is chronic non-healing wounds. We want the wounds that the patient is really having difficulty, diabetic foot ulcers, venous stasis ulcers, anything of that nature we would like. We also treat patients for other things such as failed grafts, which we can put them in the hyperbaric chambers for and have some other advanced modalities, but it's usually a chronic non-healing wound of longer than a few weeks.
And you mentioned that that might be common with diabetic patients. Are there any other demographics that are suspect to having those non-healing wounds?
It really just depends on their makeup. One of the things that we do, we partnered with Healogics to open the center, and one of the things that they bring in is we are outcomes based. So we treat the entire patient. We start with nutrition and what's causing the wound. So it could be medications that they're on, it could be their nutrition, it could be hereditary, but we look for all the indications so that once we're treating the wound, we're treating the entire patient so the wound doesn't come back or they don't have something else. It could be a pressure wound. Maybe they've had surgery and they had limited mobility, so we also look for ways to help to offload the pressure and do other things to prevent the wounds from coming back.
Very good, very good. So a patient that comes to the Wound Healing Center, what could they expect upon that first visit here?
Well, the first visit takes some time, so patience and planning is great. We do have a few forms that you can fill out online. You can go to the Clearview website and you can fill out your patient history, bring your medications and the dosage for the medications on your first visit, arrive about 15 minutes early. There is a lot of paperwork because we do treat the entire patient. So depending on where the wound is, it is going to be about an hour to an hour and a half for that initial visit. It does take time. We take pictures. You get a lot of time with the physician and with the nurses to assess the wounds and go over your plan of treatment. So when you walk out the door, you know exactly where you're going, how long the treatment plan is roughly going to take, and what your next steps are. And throughout the course of the treatment, weekly visits are pretty standard, and if you're in the hyperbaric chamber, that's 5 days a week. If not, we like to see the patient at least once a week, if not twice a week, for dressing changes.
Okay, so your typical length of stay for a patient for that first visit sounds like it could be an hour and a half to 2 hours even. After that, is it pretty regular with an hour on each of those follow-up visits?
Some are less than 30 minutes.
Okay.
So once the patient is in here and we're reassessing that wound, we're usually taking measurements. There may be a small procedure that the physician has to do while they're here, but it's usually about a 30-minute visit after that, or less, depending on where the wounds are located.
And for how many visits or for how many weeks might the average patient be under your care?
If the patient is compliant and everything is working together, usually we like to see them healed within 30 days.
Fantastic. And I assume that that's probably really good news for a lot of those patients who have been struggling with non-healing wounds perhaps their whole life or for weeks and months on end.
Right.
To see that the end could be in sight within 30 days is very encouraging, I'm sure.
It is, and it's nice to see patients heal that haven't healed in a very long time using either the hyperbaric chamber or using some sort of dressing that we have or something else that allows them to heal and walk out the door and not have to deal with a wound they've dealt with for 6 months to a year.
Very good. So wound healing isn't something that you hear a lot about. Wounds are generally not a glamorous topic that anyone necessarily wants to talk about, but the great thing is that we have a center here right in Monroe to treat those non-healing wounds. We can do that quickly, we can do that efficiently, and you're under the care and supervision of all the staff here. So speaking of the staff, tell me a little bit about your physician that oversees as the medical director.
Well, we have Dr. Peter Skronowski, who's with us, and he is here 5 days a week. He is also also a healogics physician. He's went through extra training, so he has extensive wound management. The fantastic thing that we also have is that he's a board certified plastic surgeon, so he has the ability to kind of see things as they're progressing and know more of a plan. And we work with the physicians that refer, so he will be able to speak to them and let them know if the patient's needing something else and where they need to go. But he's here 5 days a week. We're open Monday through Friday, 8 to 4:30, closed daily for lunch. And he also has some time set aside for surgery as well on Friday afternoons if need be.
Very good. So how does a patient get about coming here? Do they have to have a primary care physician referral, or can they self-refer? How does a patient get here?
The patient can call us directly.
Wonderful.
They don't have to have a referral. If we check the insurance and something is needed, then we can contact the primary care physician and get the referral, but they can call us themselves and schedule. And right now, as we're ramping up, we do have openings, so we're trying to see them same day.
Very good. Now, with it being summertime, I know there are a lot of insects out there and people playing outside and getting injuries and things like that. Do you guys treat things like spider bites or anything like that that has increased over time?
Yes, we do. And I would rather the patient come here and see us, and if it's not the right center, then we can get them in touch with who they need to go to. It's better to come early than to wait until later on and the wound be so severe that it's going to take longer and go through the pain of the wound. Just come here. We have an expert on site. Let him assess the wound. Let our nurses who are trained to look at it, look at the wounds, and if you don't need to be here, we'll get you where you need to be.
Very good, very good. Well, it's great to have such a wonderful resource right here in Walton County. And if you do have questions about Clearview's new Wound Healing Center, you can visit us online at www.clearviewregionalmedicalcenter.com. Go under Medical Services and then click on Wound Healing Center. In addition, they can call you guys here at the center direct at 678-635-8010. As Stephanie mentioned, they're open 5 days a week, Monday through Friday, and you can reach out to them directly. Anything else that we want to let our viewers at home know about our Wound Healing Center?
We're just excited to open and offer this service to the community, and we look forward to meeting more members of the community and helping them.
Excellent. Well, let's take a step back and look at our hyperbaric chambers. We're here in the new Clearview Wound Healing Center, and we are fortunate to have Miss Crystal Ash with us, who is our technician for our hyperbaric chambers here. Now, Crystal, this is a hyperbaric chamber. What exactly does that mean?
It's a pressurized oxygen chamber, so the patient lays in there. And it's under pressurized oxygen for wound healing.
Okay, and so what would be the benefit of infiltrating oxygen into the body?
It accelerates wound healing. There's other benefits that they're researching, but right now that's what we're using it for.
Okay, so a patient would lie on the bed here at this end, and they would be slid into the chamber. Does anyone ever report being claustrophobic while they're in there?
Yeah.
So what are some things that you guys do to combat claustrophobia or the fear of being in there?
We try to just talk to them, maybe just help with their fear. They also prescribe medication for like anti-anxiety medications.
Very good. And what do they actually do once they're in there?
They just kind of lay there and watch TV, or they can bring a movie and put it in the DVD player, but that's just kind of hang out.
Fantastic. Okay, so that's kind of what the patient is going through, but explain to me the behind the scenes of what you're actually doing here to operate the machine.
I sit here and monitor them the entire time while they're there. They can talk to me, and I can pick up the phone and talk back to them. So if they have anything going on, I'm right there the whole time. So I just monitor the treatment the entire time.
Okay, and then what exactly is going on inside the chamber?
It's just a lot of pressure. That's pretty much all that they feel is just pressure.
So I've heard hyperbarics being referred to as a dive before. What exactly does that mean?
They refer it to similar as feeling like when you're diving underwater. So it's just like the pressure you feel, or similar if you're going up into airplane, the pressure you feel in your ears.
So is there equivalent of depth that you would be diving to in the chamber?
Most of the time it's about 33 feet of seawater that people dive to.
All right, so if we were to actually go swimming and go diving to 33 feet, we would feel the exact same pressure that we would here in the hyperbaric chambers. Okay, very good. Are there any other things that go into hyperbarics? For instance, do people need to have tubes put into their ear, or how does that work exactly?
Yeah, possibly some people may have a lot of pressure in their ears, and they don't quite get the drainage that they need, so then they can get tubes put in their ears to help with not having any pain in their ears.
Yeah, helping with the pressure and whatnot. Okay, very good. Interesting. So how long have you been here at the Clearview Womb Healing Center has been open since June the 16th. And how long have you been working with hyperbarics?
About a year.
Okay, very good.
I went last summer to Healogic's corporate office and did training there, and worked at another wound care facility. Helped out in hyperbarics. Yeah.
Well, good. Well, we're glad to have you here. So don't be scared of the hyperbaric chambers. It's definitely a healing methodology and can help those wounds to heal a lot faster. Not to mention the hyperbaric chamber itself is entirely encased. However, you can still see out of it. And watch TV, as Crystal was talking about, bring a movie, whatever you might need to do to keep yourself calm during one of these treatments. And how long does one of these treatment sessions actually last?
The treatment is about an hour and a half, but it takes time to get to pressure and to come back from pressure, so it's usually about 2 hours.
Okay. And how often does a patient normally undergo hyperbarics?
Every day, Monday through Friday. And they have a set time that they come every single day until their number of treatments are up.
Oh, what's the average number of treatments that a patient would have?
Usually about 40.
40? So that's a lot of diving in and out every day. Very good, very good. Well, thank you so much for telling us a little bit more about hyperbarics. And in the event that you want to come and check them out, you can stop by the Wound Healing Center, and Crystal can answer any questions that you might have about something like that. Thank you so much for visiting with us today at Clearview's Wound Healing Center. As I mentioned before, we're located right off of Breedlove Drive beside our old hospital location at 705 Breedlove Drive. The Wound Healing Center can be found in Suite 300. Their information can be found on our ClearviewRegionalMedicalCenter.com website, as well as their phone number is 678-635-8010. If there's anything that we can do to help you, a family member, or a friend with a non-healing wound, please don't hesitate to give us a call. We'd love to get a look at it and see what we can do to help you heal. Thanks so much for tuning in, and we'll see you next time.